So this means delaying surgery may be a good thing. When we talk about whether or not it's okay to wait to have ACL surgery, there are a number of factors to consider, but I'd like to start with the condition of your knee. If your knee is in bad shape, you may think it's best just to get surgery over with.
Yeah.
Rightfully so, but the data suggests that you may be better off taking as much time as necessary to rehab the knee before surgery.
What?
The closer you are to 100% heading into surgery, the more likely you are to have a successful outcome in the end. The topic of having surgery or not is also an interesting discussion, as a growing population of people are actually opting to see if they can avoid surgery altogether. Very little evidence reveals there are better outcomes for those who get surgery versus those who do not. If there's any doubt in your mind that you want to get surgery, take a few months. Rehab as hard as you can, and who knows, maybe you'll convince yourself and your doctor that you can bypass the surgery. When talking about returning to sport, it's possible that waiting for surgery can delay your ACL recovery timeline a bit. For instance, if you wait 2 to 3 months to have the surgery and then still require the traditional 6 to 12 months of recovery time on the back end of the surgery, then your recovery is going to be about 8 to 15 months. On the other hand, if you opted for surgery right away, you may be able to keep the recovery timeline at, say, 6 to 12 months. Personally, I believe that this is why many professional athletes opt for surgery as quickly as possible. Lastly, it's important to take research into consideration as well. A 2017 study tracked the results of 118 people with ACL ruptures for 5 years. About half underwent ACL reconstruction within 2 months of injury, while the others did exercise therapy first. Of those who tried exercise therapy before surgery, 30 eventually had ACL reconstruction and 29 avoided ACL surgery altogether. That suggested that delaying ACL reconstruction and managing ACL rupture with exercise therapy alone may shift prognostic factors for 5-year outcomes in a positive direction.
Whoa!
So, this means delaying surgery may be a good thing.